Hi, I'm Brian Utting from the Pacific Northwest School of Massage, broadcasting live from my kitchen in Seattle, WA. I've been asked to say a little bit about precise techniques for the muscles and ligaments of the neck, and I was also asked to make a little taster video explaining some of the principles behind the work and one sample technique. I think we're going to do the posterior facet capsules of the neck, since it feels really good to have them massaged with precision, and they're commonly injured and irritated structures. In addition, there are a lot of the small paraspinal muscles that we'll be working with in class that attach either on or adjacent to the facet capsules. So we can kind of get 2 for 1 or double dip by working on both at the same time. Clients report that it feels really good. Sometimes they'll say it hurts good, or aches good, or that's the spot. And it's something you can do in an everyday massage, not just for injury treatment. A lot of our clients think that the motion in their vertebral column comes from the vertebral bodies and the discs, but they don't actually move that much. They're semi-movable joints, cartilaginous joints. Most of the motion in the back comes from these facet joints in the back. This guy, his facets are a little bit stretched apart, although you can see one right here where the two surfaces are interfacing. So to say it another way, when vertebrae move, the vertebral bodies are relatively fixed, and it's the facets that are making all of the motion. Here's a picture of the facet joints up around C1, C2. You can see each joint has a joint capsule, a synovial joint capsule, and you can see over here the two little cartilaginous surfaces that move against each other. There's synovial fluid in there on this side. This is actually a picture of the anterior facet capsules, but they look almost identical on the posterior side. Here's a picture of the facets on the neck, posterior facet capsules, as well as some of the small paraspinal muscles that are in the area that allow for segmental motion. Each facet has a joint capsule, a capsular ligament, and when you palpate them, they often feel like smooth, rounded river stones. They're exquisitely sensitive and often ache in a good way. This shot also gives us a little bit of a hint of the elegance and complexity of all of the small muscles in the neck that work in concert to allow segmental motion. This picture, I think, even shows it more from an engineering perspective. This is from Travell, and you can see that it's sort of like a living scaffolding or living tensegrity mass. Speaking of tensegrity mass, here's one that is modified to show the vertebra, which are the fixed part, and the muscles and ligaments, which are the tensile part. Here's an even closer shot of the facet capsules. You can see them here, and some of the small paraspinal muscles, including lots of attachments here on the transverse processes. We'll be getting those in class. But what I want you to see here is all the muscles that attach right on or right adjacent to the facet capsules. So these small little intrinsic muscles are right near the site that they're moving. And when we go into massage, we can get both those muscles and those facet capsules. The facet capsules are often irritated and or injured, and the small muscles are often stuck, in pain, or not fully moving well. When you palpate somebody's neck, you usually feel 2 ropes or cables, one on each side of the neck. The muscles that primarily make that up are the semispinalis capitis, this one here, and the longissimus muscle, which is one of the erector spinae groups. Over here we have the origin insertion of the longissimus. You can see it goes all the way up to the mastoid bone, and here you see the semispinalis capitis. So they make up 2 ropes, and then medial to them are 2 ditches, which is the lamina, and we'll be addressing some of the muscles in the lamina in class. For this particular demonstration, we're going for the posterior facet capsules. And so we want to go posterior to the levator scapula right here, but lateral or anterior to those two cables, the semispinalis capitis and the longissimus. So in front of the ropes, but behind the levator is a space. We're going to go into that space, and here's a picture, a cross-section of the neck at C4. We're going to go into that space, that crevice. We're going to aim up towards the ceiling, and we're going to polish those facet capsules, those things that feel like river stones. Notice this orange here. Notice all the muscles that attach around the facet capsules. By the way, these are partially colored orange in order to convey the impression of a cable, because these muscles make up that bundle that we identify as the erector spinae or the semispinalis. So we're going to go behind the levator, lateral to the cable, up towards the ceiling, and we're going to polish those facet capsules and all those little attachments. First, we're going to palpate the levator scapula. As I say, it's not as broad as some of those pictures suggest. It's ropey on almost everybody. Gets a little bit bound up on people, partly probably because they use it to hold up their head. And here you can see me flipping across the levator scapula. So Emily's levator is pretty supple compared to a lot of folks out there. Then behind that is a crevice. This is the crevice between the erector spinae and the levator scapula. And what I'm going to do is put a couple fingers, middle and ring, in each crevice. I'm going to let my elbows go wide so that I can slot my fingers to be parallel to that crevice. Then I'm going to push up towards the ceiling and polish those stones. Clients usually report that it aches in a good way because the ligaments are so highly innervated. And it's a good ache. Is that true for you, Emily?
Yeah, definitely.
So she's got a little thing going on right here. I think it's about C4-5. So I'm just giving that a little extra attention. You can feel buildup on people sometimes, often a location where they've been injured. So again, I'm pushing up towards the ceiling, not medially, but up towards the ceiling, so I can get behind those posterior facet capsules and polish them. And there you have it. Thank you very much.